In 2022, a new era of transparency began in American healthcare. The Centers for Medicare and Medicaid Services required health insurers to publicly share machine-readable files, massive data sets showing the prices they pay for services across their networks. Providers were also required to post their own versions annually. At first, this seemed revolutionary, but reality set in fast. These files are enormous, complex, often inconsistent. Parsing them into anything useful proved to be a serious challenge. The result? A wave of initial optimism has given way to skepticism. Skepticism about the quality of the data and about how or even whether it can be trusted to inform strategy. Most transparency solutions take a neutral approach. Upload the raw data, wrap it in a flashy interface, and let the user figure it out. But as any data expert will tell you, if the foundation is flawed, no amount of polish on top can fix it. Think of it like water distribution. You need infrastructure, pipes, taps, valves. Well, that's the user interface. But more importantly, you need the water to be safe, clean, usable. That requires testing, filtration, and treatment. The hard stuff, the science. Even if one person gets sick, trust is gone. Transparency data works the same way. At Starset Analytics, we've spent 3 years doing the hard work, partnering with actuaries, healthcare finance professionals, statisticians, and engineers. We've built a system focused on quality, not volume. We clean and refine the raw files. We cross-check against secondary sources. We backfill missing data where we can, and we assign each data set a confidence rating, so you know exactly how reliable the results are. Our goal isn't to give you everything, it's to give you what matters and make sure it can be trusted. As an HFMA provider enterprise member, you now have access to a curated transparency data tool built using this rigorous quality process. It doesn't cover every network or provider yet, but it includes many of the most used networks across the country. And most importantly, it's been tested, filtered, cleaned. You can explore the data with confidence. And when you're ready to go deeper, whether it's a specific contract, network, or market, our team is here to help. This tool is just the beginning. Together, we're taking the first steps towards making market pricing data usable, trustworthy, and transformative for healthcare finance. We hope it empowers you and your organization to make faster, smarter strategic decisions and extends your ability to do the important work you and your team do in serving your communities each and every day.